Welcome back, everybody. We're now going to talk about a very important issue that has become increasingly apparent over the last 3 years during the COVID-19 pandemic, and that is the really important issue of food insecurity. A particular challenge for those with chronic illnesses and incredibly relevant in the context of celiac disease and the need for access to special foods and a gluten-free diet. So I'm delighted to introduce you to our next speaker, who is a registered dietitian. Inez Martincevic is a clinical dietitian practicing within the Division of Gastroenterology, Hepatology and Nutrition at the Hospital for Sick Children in Toronto. She completed her undergraduate and graduate studies at the University of Toronto, working closely with leaders in clinical nutrition, and in collaboration with her gastroenterology team, Inez cares for patients affected by many chronic diseases involving the gut, liver, and pancreas. She also participates in research endeavors looking to improve diet, nutritional status, and the quality of life of those affected by these conditions. So join me in welcoming Inez, and over to you for the next presentation.
Thank you very much, Dr. Armstrong. And thank you to everyone who's participating in today's event. I will share my screen now. And I hope everyone can see it. So I'll do my check-in just to make sure everyone can see the slide.
Yep, we can.
Wonderful. So thank you to the Canadian Celiac Association for sharing this opportunity to be able to speak to such a sensitive but important topic, as well as to Dr. Inez Sanchez-Pinto and Shelley Case, who provided insights in creating the information that I'll be sharing today. Okay. So we're just going to initially start by defining food insecurity. It is a topic that, as Dr. Armstrong mentioned, is discussed a lot lately. We just want to make sure that we all know what we're talking about when we mention the term. We want to know how food insecurity also influences in the management of celiac disease, definitely as it relates to today's event, and then brainstorm some ideas as to how we might be able to address this topic. So information related to food insecurity in Canada actually comes from Proof for this presentation. Proof was created in 2011, actually, through research-related grants looking at health and health inequity in Canada. And Proof shares information about food insecurity, which means the inadequate or insecure way to access, meaning to get food, due to financial or monetary constraints or hardships. And based on the latest data, which is from 2021, meaning it was summarized in 2021, this information was gathered with years prior to 2021, looking at Statistics Canada Canadian income survey data, that's a tongue twister, about 5.8 million Canadians, and that includes 1.4 million children, live in food insecure households in Canada. And those figures are actually considered to be an underestimate. Of course, it's not relevant to today, 2022 per se, but it also doesn't include individuals that are from First Nations reserves. It doesn't necessarily include information from people that live in very rural areas in Canada, nor does it include information for people who don't have households or homes. And these are groups that are very, very vulnerable and high risk to food insecurity as well. And although the data from provinces across Canada is variable and different, as highlighted in this figure, Proof and other sort of research groups or federally run groups that look at, Canadian income and Canadian demographic information, they're able to report these numbers, but they're not able to tell us why people are food insecure. And that's important for healthcare providers or groups like the Canadian Celiac Association that actually advocate on behalf of individuals who have their health affected, because it doesn't necessarily provide us the information as to how we can strategically pinpoint initiatives to address this problem. But still, we want to understand food insecurity and we want to know more about it. Why? It's because adults that live in food insecure households, they have poorer mental health, poorer physical health, poorer oral health, more likely to suffer from chronic conditions. They may find it harder to manage these conditions, more likely to become a user of our healthcare system, which we know across Canada is in perils right now, with health ministers gather to discuss with Canada, what are we going to do about ongoing issues with our healthcare system? And they're more likely to die than individuals that are food secure. As this relates to children and health, we know that children who come from food insecure families, they're more likely to experience mental health issues like anxiety or hyperactivity, attention deficit disorders. They also, in addition to being diagnosed with these things, might experience behaviors that make it more challenging for them to have a fulfilled quality of life, lower self-esteem, lower ability to make healthy food choices, which we've heard is a reoccurring theme during this event. It's so important to eat well and to find healthy foods and to sleep and to exercise and have a healthy lifestyle. But all of that is more challenging if you're food insecure. And then let's add the layer of being diagnosed with celiac disease to this conversation, because I'm pretty sure that as I speak to everyone today, we all know that when compared to gluten-containing comparable products, gluten-free foods cost more, and they're not always necessarily as easy to find as gluten-containing counterparts. And so, how does this affect us as we start talking about food insecurity, health, and celiac disease? Well, we want to show that this isn't necessarily just a problem in Canada. It's a problem globally, all over the world. There are many studies that have been done in Canada that show that there's a significant price difference between gluten-free foods and gluten-containing foods. And although more recent data shows that cost difference has significantly been reduced in the last 10 to 15 years, experts in the area feel that it's related to there being a more popularity behind consuming gluten-free foods. And so there's more commercially available gluten-free products, that results in prices being driven down because it's a more competitive market. But even though we know that that might be the case, and some individuals might argue and say, well, the price has come down significantly, some products even 100% lower in price, what it doesn't address is the nutritional quality of the gluten-free foods that are available, and how production and how nutritional density affects these costs. The same has also been shown in other countries around the world, these ongoing disparities between costs and individuals who have to maintain a strict gluten-free diet being impacted by that. Similar data has also been shown as it relates to being able to get and find gluten-free foods. And so while we all know that there are more options available to us, especially during COVID, that made it maybe a little bit convenient or easier to get foods. One piece of information that I find extremely surprising is recent data has shown that gluten-free foods online are actually more expensive in stores, and that the variety, the selection, the options, everything that individuals want about gluten-free choice, they're mostly available in high-end grocery retail areas or health food stores. And this data is really important because that further highlights that individuals who are at risk of being food insecure are now more at risk, or individuals that may have been food insecure are now at higher risk of food insecurity, because in order for somebody to find the choices, the healthier gluten-free foods maybe, not only are they having to pay for more of them, but they're also having to go to establishments and outlets that provide them with that choice, and ergo might be upping the price in order to make it available to you. These food insecurity risks, they're a concern among Canadians right now. And Nicole Byron, who is the health promotions manager at the Canadian Celiac Association and a dietitian, spoke to all of these worries with news media outlets recently, because it is such a relevant topic, especially if you have celiac disease. And why do we care about it as it relates to having celiac disease? Well, we know that health-related quality of life scores are lower if you have food insecurity and celiac disease. We've demonstrated repeatedly that it's related to how much people have to pay for these gluten-free foods, as well as being able to find them and source them. But what I find most triggering is the evidence, which has been reproduced more so now during COVID, that actually shows individuals who want to maintain a strict gluten-free diet have a harder time doing so if they're food insecure. That means if you're not able to adhere to what has been prescribed as the only treatment for celiac disease right now, the strict gluten-free diet, you're going to have negative health impact. And it just circles back to all that data that Proof has gathered and shared with Canadians to say, we have a huge problem right now in Canada as it relates to getting food for health. And it's very apparent now during COVID. There have been studies that have recently been released really highlighting that getting gluten-free foods during COVID was harder, and that meant sticking to the gluten-free diet was harder, which meant that health was being impacted. And so what are we going to do about this? How are we going to be able to address food insecurity? Well, Rachel Dacca, who is a dietitian that works with the McMaster team, has worked to come up with some shopping tips that empower individuals, in addition to other dietitians who've shared information to share with you all today. You know, doing things like shopping on sale, looking for coupons, price matching, you know, really being vocal about getting out there to get the best price for your value can work. Shopping to purchase less gluten-free packaged processed foods and really focusing on the perimeter of grocery stores where all those fresh, wholesome, naturally gluten-free foods are available can help. Shopping for more plant-based foods is also a cost-effective alternative. There are huge initiatives through Health Canada and other nutrition-focused agencies in the world now that in order to maintain a healthy lifestyle, you want to pick healthier food choices. And a part of that is eating a more plant-based diet. So more protein, more fiber, healthier fats that come from these types of foods, which if you can purchase and find when they're more so in season, can be more cost effective. You want to shop with a list. You want to be able to budget. and Jessica Pernak, who is a dietitian as well, and works with the Canadian Celiac Association. She gave a talk yesterday about knowing how to budget when you're on a gluten-free diet, and also shared some valuable tips and resources that you all can access. Which include shopping in bulk. So if you shop at warehouse outlets, or if you can, not necessarily purchasing from bulk bins, but if you can purchase safe gluten-free foods that are in larger sizes, your cost per unit can come down, which can certainly decrease the cost of your grocery bill. And thinking about bulk items that are dry items, first of all, making sure that they're safe and gluten-free. You know, you can refer to the labeling guide that the Canadian Celiac Association has, but things like legumes and grains that you can buy in larger bags or boxes that you can store and house in your pantry to use over time, or picking things that are frozen. I mean, we do live in Canada. We don't exactly have a huge ability to access fresh foods during, you know, fall and winter months. But if you purchase frozen, you can then use it throughout the year. Other than shopping, there are other suggestions that might work for you and your family, such as cooking in really large batches when you can access foods at a better price, and then packaging it into smaller serving sizes or individual portions that are then frozen to eat later. You can look at connecting with food assistance programs such as food banks locally that might have gluten-free foods for you to be able to bring home. You know, learning more about the medical tax credit through the Canadian Revenue Agency to be able to get reimbursement based on your total annual income. That might be able to provide some funds back that can be recirculated into your grocery bill as it relates to buying gluten-free foods. You know, in connecting with the Canadian Celiac Association, celiac chapters, support groups, even, you know, online recipe groups to talk about gluten-free issues, but to also share ideas and means to be able to try to eat a healthy, balanced gluten-free diet in such a way that can be affordable and in such a way that can be local, depending on where you live in Canada, as it relates to finding these gluten-free foods. Now, one thing I would like to highlight is that there are various different programs that exist, you know, food banks, community gardens, and other such establishments. And they've existed for years to help people that are at risk or that are food insecure. But one thing that we've learned year over year is that even though, and I'm not here to minimize the tremendous value that these establishments have in helping and supporting individuals that are food insecure, but they haven't solved the problem, nor have they reduced the rates of food insecurity. And that's where we really need to advocate. We need to direct our concerns to policymakers, to the government, and advocate. Learn more about maybe other programs that exist in the world that help individuals with celiac disease, target policies, looking at income-based programs and how they might be able to support more for those individuals that are medically prescribed a strict gluten-free diet. And so we know that food insecurity is a concern. We know that if you're food insecure, it impacts your health. We know that individuals with celiac disease are at higher risk of food insecurity because of the strict gluten-free diet. And I encourage everyone to collaborate and to advocate, because in order to help, we need to make a change at a higher government level to support everyone's health as it relates to managing your celiac disease. Thank you.
Inez, thank you. That was a superb presentation. It's obviously relevant to celiac disease, but actually, as you indicated, to many other conditions as well. And I think there's a huge amount to be learned from this. I think this is a good time to open this up to questions. Thank you for sticking to time. We have a good 15 minutes to field questions or bat them around, or just decide if we're going to pull up placards and march on Parliament Hill in the next few months. Anyway, I'm going to hand back to Mark.
Thank you very much. I'll first mention there was the mention of the State of Celiac survey. So this is a world-class study on people living with celiac disease, and there are sections on nutrition, food security, and quality of life. Just want to encourage anyone out there, if you yourself have celiac disease, please participate. Having this critical data in hand helps us more effectively push for change and to push government and industry for more celiac safe options. And the information is highly useful for celiac disease research. It's been cited that the past versions of this survey have been cited in a number of academic articles and research studies. So if you can take some time, please fill out that survey. If you go to celiac.ca, it pops up to you right away, and they also drop the link in the chat. So thank you very much, Inez, for the presentation. First, so you mentioned about frozen foods, as a way to save on funds. I know there's concerns out there, like it just has a reputation of being less healthy than fresh foods. Like, is that the case? And what's the best way of handling frozen produce to not sap all the nutritional benefits?
That's a great question, Mark. And I do get asked that often, actually. If the foods are frozen fresh, then it doesn't significantly impact the nutritional quality. In fact, studies have shown that it's the food preparation that may actually impact it more so. So when I'm talking about frozen foods, I'm talking about wholesome, fresh foods that have been frozen. So you're grabbing, let's say, a bag of fresh blueberries from Newfoundland, which are delicious, or potentially, even if it's the case, peaches when they're in season in Ontario. Those are the produce that you're looking for. So fruits and vegetables frozen, not necessarily referring to meals that are gluten-free that have been frozen and are just reheated.
And so if someone buys something and they are going to freeze it, is there a difference in nutrition content if you freeze it immediately or on the day of the best before?
That's a great question too. Ideally, you want to freeze it as soon as you know that you're going to use it for a later date. We certainly know when you leave produce in the refrigerator, it naturally will oxidize. It affects the texture and taste. It can affect some of those micronutrients that have the potential to also oxidize. But I would say you want to freeze it as soon as possible, because you also want to preserve the crunch and the other profiles of the food that make it desirable and tasty.
Thank you. And there's so people who are food insecure, or people who are food secure, can become insecure because of the high cost of gluten-free food generally, and even more now with inflation. I know that, I don't know if you're able to comment on the tax return aspect that people can claim the incremental cost of gluten-free foods on their tax bill.
I am certainly not an accountant. I am not certified as it relates to that specifically, but from the general perspective, this is the program that exists in Canada to help individuals who have to be strictly gluten-free with celiac disease. The program is that the price difference of gluten-free foods can be tabulated when you do your taxes and then submitted through the medical bracket. And so it is not a dollar for dollar return. I always clarify with families, it is an assessment that is done through Canada Revenue Agency based on your total annual household income. So the returns are based on how much you do earn, which I do encourage individuals, if you're doing your own taxes or if you do work with an accountant, to actually evaluate whether or not there is a benefit to submitting, you know, because it does vary based on your total annual income. But to speak to that, Mark, there are other programs that exist in the world, and Dr. Inez Sanchez-Pinto has actually published on this, you know, looking at some other countries like in the UK and other European countries where they do have a bit more of a medical-driven gluten-free food system, and you know, whether or not Canada might be able to adopt something like that or look into that, because of course every program has its pros and cons. But the end conclusions of most of the studies to date have actually said that you need to target policymakers, and that policymakers need to look at income-based programs as it relates to reimbursement and minimizing these food insecurity rates.
Mm-hmm.
You know, so it's an option that Canada has that we have right now. Whether or not Canada could do more for the celiac community is the question, and how do we go about doing that? And that's why it's so important to have these events. And we really appreciate the Canadian Celiac Association for this opportunity to share, because we are a voice for the community. So the more that the community does participate to help support the Canadian Celiac Association, it might make a difference as it relates to, as Dr. Armstrong said, you know, stomping on, you know, parliamentary hills to have the voice be heard.
Thanks. And I can also mention the CCA has a tax webinar on our YouTube channel. We're going to drop the link in the chat if you want to know more about making that claim on your taxes.
And also, sorry to interrupt, it was
Sure.
just shared right now, but the UK is stopping the prescription program. There had been rumblings that the NHS was actually going to stop that program. There was a lot of concerns in the UK about it actually not working for people with celiac disease, and it was related to the very minimal amount of gluten-free options that were there. So individuals could go to stores and find something they wanted, but because it wasn't listed on the government's gluten-free choice, families weren't reimbursed for it. So again, just to highlight, not all the programs necessarily work well. And so it's really about learning what others do and then what we can do here in Canada.
Thanks. And Dr. Armstrong, I see you have your hand up.
Yeah, I was just going to make an additional comment. I mean, I think it's important, obviously, that the tax credits are beneficial, and one certainly wouldn't want to do away with them, but it actually discriminates, I would argue, specifically against those who are at most risk of food insecurity. Those on low income already are not going to pay much anyway in tax, and therefore will not benefit from this. So it's a double whammy. And as Inez says, the implementation of programs is also problematic. Because you can introduce a program like prescribing food, but if you don't then provide the back end to make the food available or provide the appropriate lists, you can basically, as we say, scupper a program before it actually starts, and you can handicap it so that you can demonstrate that it doesn't work. So you probably got me on a rather grumpy day with respect to government and the management of healthcare, but I'll throw in my 2 pence anyway.
Thank you very much. Inez, this is more of a comment. Someone talking about how, you know, we're encouraged to shop the perimeter of the grocery store and not the aisles as much due to the freshness of the products, but the fact that it takes a certain knowledge level and skill set and kitchen equipment necessarily to prepare these fresh and whole foods, and it might not be as practical for food insecure families. Any thoughts on that?
Certainly, and that's part of the issue. We also do know that fresh, out of season produce can also be more expensive. We know with also harvesting, weather, supply, demand issues, that also affects costs. So shopping around the perimeter also relates to trying to find those healthier options as it relates to eating the balanced gluten-free diet. But to your point, Mark, there is an awareness of also budgeting. So it's budgeting within the perimeter as well, and that does take time and practice. We did have a speaker just before me. I will mispronounce her name, so I won't try it. But she talked about giving yourself time to learn, time to ask questions, time to seek support. So with practice and getting into the habit of writing lists, budgeting, looking at what's on sale, looking at the perimeter, taking the time to grocery shop, these are all the behaviors that you want to adopt, and be nice to yourself, because it is a huge learning curve. But it relates to every single topic that we've discussed today, you know, and looking at how not only can we, you know, achieve getting the nutrients that are important, eating that balanced diet, you know, sticking to the budget, all of that relates to these tips that we've shared today, but they're not all easy. They do take time. They do take commitment. You know, and it's really about making it important for you. You know, and that's where getting in touch with celiac chapters, getting in touch with registered dietitians, other healthcare practitioners, you know, and really using support groups to help is important and vital.
Definitely, yep. And this will be our last question. When we talk about, like, people hear plant-based foods and they think expensive. They think, you know, those artificial meats like lab-grown meat and various other vegan products that cost an arm and a leg. But I know that's not what you were putting across. Can you give suggestions of people who want to incorporate more plant-based options into their diet, but might be food insecure and are wanting to look at other healthier options?
That's a great question. So this also piggybacks a little bit on what Jadid was speaking about earlier. So you're right, we're not talking about the trendy foods necessarily. We're not talking about sort of these healthy advertised options that are sort of pre-done for you. So when we're talking about more plant-based foods, plant-based sources of protein and fiber, we're talking about grains. So things like quinoa, buckwheat, millet, purchasing them in larger sizes dry, and then, you know, cooking them. We're talking about purchasing legumes, and so this would be your beans and your lentils, which are great foods that you can add to savory dishes, sweet dishes, hot dishes, cold dishes, so salads and stir fries. You know, I encourage individuals to maybe not make a traditional stir fry with just rice, you know, blend it with a little bit of buckwheat. You know, add some different crunch to it, add lentils to a lot of things that you're eating, thinking about a traditional gluten-free lasagna, for example, and then filling it with beans instead. So we're talking about beans as well. And then we're talking about nuts and seeds, of course, and purchasing these also, making sure that they're safe, that they haven't been overly processed or dredged in sodium, which is, you know, a very common thing. And adding those to various other either snacks or dishes, you know, making a homemade gluten-free trail mix for yourself, or a gluten-free granola that you can add to yogurts or ice cream for added, not just bite, but also, you know, health. So yes, Mark, we're talking about foods as they exist pretty much in nature, and then learning to add them and complement them to whatever traditional kind of sort of dishes you have, whether it's culturally based or whether you're trying different culture dishes. And that's where the recipe sharing really can be helpful, Mark.
All right, thank you very much. I'll mention, yeah, for beans and lentils, try to look for a gluten-free claim, of course, and despite the word, buckwheat is gluten-free, assuming it's not cross-contaminated. All right, thanks very much for that.